Hi, myself Dr. Sumit Agarwal. I am a consultant plastic and cosmetic hair transplant surgeon based in Mumbai. I practice at Harleys Clinic and Leelavati Hospital in Mumbai and at Harleys Clinic in Dubai. Today, I am going to discuss about the common myth that a lot of care needs to be done after the hair transplant, and that's why a lot of patients they avoid doing a transplant. Yes, there is some extra care required after the transplant. Like any other surgeries, you need to take some extra care, but it is quite manageable. So today I will just give you a brief what actually happens and what you need to go through during the recovery period. The hair transplant procedure is done under local anesthesia, so you are conscious throughout the procedure. You may be listening to music or watching videos during the procedure. You comfortably. You will get some short breaks during the procedure for coffee or lunch break because the procedure spreads over a period of 5 to 6 hours, and you will be quite pain free during the procedure. It's only at the start of the procedure when local anesthesia is given it you feel the needles. Now in the evening when you walk out of the operation theater, there will be a bandage on your head, so you need to be careful about the bandage. You need to avoid picking up anything from the floor like your shoes or anything. You need to be careful of the overheads in the bathroom, so you need to take care about your head. Your drive back home should be slow and smooth, and avoid jerky and sudden movements. And you yourself cannot drive for at least 10 days after the transplant, and you have to avoid wearing the helmet also for the first 10 days. When going back home, your surgeon will prescribe you some painkillers, and along with the antibiotics and anti-inflammatory medicines for the first 5 days. You have to take the medicines as per the prescribed schedule. There will be the bandage on the head, so you need to be careful that the bandage should not come out during sleeping and all. You have to do some saline sprays on the grafted area, so so the nurse will explain you how to do saline spray, so you need to follow the instructions accordingly. You are advised to take rest for a day or two after the procedure, and like take proper care, have homemade food, avoid outside food, and while sleeping keep your head in the elevated position. Maybe you can put one or two pillows or sleep on the couch for initial 2 3 days, and avoid touching the transplanted area. If you have pets or young kids, you need to maintain a safe distance from them. And then after the second day, you will be called to the clinic for changing the bandages and all. And then third day after that, you will be asked to take head bath with lukewarm water. It is important to start the head bath from the third day, and after the bath you can just gently dab and dry your scalp. Avoid rubbing the grafted area, and once you come out of the shower, you can just apply antibacterial cream only on donor area from where the grafts have been harvested, not in the front area. You apply the cream in donor area and then leave it open. No need to wear any bandages after the third day. Maybe you can just keep your sports band on so as to avoid swelling and keep the donor area covered. This daily schedule of head bath with lukewarm water and antibacterial cream continues for the first week, and after the first week you are asked to start washing your head with a mild shampoo. Maybe the clinic will advise you a mild shampoo which you can use for the daily wash during the initial 2 weeks. Shampooing is a very important step in the aftercare of hair transplant, because shampooing is important to avoid crusting and scab formation. Otherwise, those scabs and all can lead to dryness and dandruff in the coming weeks. There is some other important extra care required after hair transplant, like any other surgical procedure. Like you are advised to avoid alcohol and smoking for the first week after the transplant. You are asked to avoid going to the gym, exercise, or any strenuous activity for first 2 weeks. Preferably you should not sweat. You are advised to avoid swimming pool and direct sun exposure for at least 3 weeks. Maybe you can wear a cap or a hat, and you are asked to avoid hair color or haircut for the first month after the procedure. Now, during the first week, there will be some swelling on the forehead area and around the eyes. So you don't need to panic. That is an expected part of recovery from hair transplant. You can do some ice sponging, cold sponging. That will help swelling to settle down fast. Your doctor may have already prescribed you anti-inflammatory medicines, which will which will be helping in reducing the swelling. So it is preferable to take a week off from your schedule for the procedure and early recovery. And I generally advise my patients to take a week off, and after 7 days, once they start shampooing, they can comfortably resume their office and maybe just wear a cap outside. If patients are coming from outstation or overseas patient, they can travel 2 days after the procedure, after the first dressing. They just need to be extra careful that while traveling, they should not bang their head against the overhead cabins and all. And they should avoid lifting of heavy weights during the travels. And once they reach home, they take rest for the first week. I hope this information will be useful for you to make a decision regarding the hair transplant. It will help you in clearing some of your doubts regarding the recovery of hair transplant. If you have any further doubts about hair transplant procedure or recovery, you can contact Harleys clinic in Mumbai, and you can even mail us. Thank you. Bye.